To my fellow Kootenai County residents, good afternoon. My name is Bob Norris. I'm a candidate to be your sheriff. Today is March the 20th. It's about 1 p.m. I've been an incident commander, I've been a branch director, and I've been boots on the ground in many different events, such as wildfires, earthquakes, riots, even medical events such as a rise in tuberculosis and measles. And the handling of all of these events is very, very similar. In fact, one of the biggest questions that I receive is, at what point in time do we know that we're going to be leveling off? Well, I got to tell you, it doesn't appear that we're anytime soon with that, and I'd like to show you a couple of charts. Keep in mind, remember about 30 days ago, we had 18 cases here in the United States. Well, currently now we have over 16,000 cases. So this is a chart that illustrates that upward trend. So we are obviously haven't seen any of that flattening out yet. And that illustrates that upward trend. So we went from 18 to 16,000 in just about 30 days. Another chart I'd like for you to take note of when I do my research, and something you can consider, is how many new cases we're getting every day. So in this particular chart, from 2 days ago we had 2,900 cases. Then yesterday we had 4,500 cases. So this illustrates that we're also still in an upward trend. Now, this is the chart that we used in a previous video, and this particular chart shows what we want to occur, and we want that flattening. We don't want this big peak. We want this flattening area. So that's what we're trying to achieve, because remember that dotted line was our maximum medical capacity, and we wanted to reserve that medical capacity for those that need the services the most. So if I could leave you with this, let's hope for a sprint, but let's be prepared, and let's prepare our families in case we have to do a marathon. Let's talk about the President's message that he came out with a few days ago. One of the guidelines was, let's only have gatherings of 10 people or less. Well, I have to tell you, I've been around town and driving when I'm going to the grocery store, and I see that we have establishments that are open and have a lot more than 10 people in. And really remember, the reason why we want to do this is we want to limit the exposure to our elderly community. We don't want younger population going out, contracting the virus, and then transmitting it at home to the most vulnerable. That's what we're trying to prevent. Let's talk about Kootenai County. Kootenai County, we've had one confirmed case, male in his 60s with an extensive travel history. That case, he's now being self-quarantined at his home. Good news is that we've not had any incidents related to theft or disturbances to this virus here in Kootenai County. So whenever you're doing your research, please remember to only use trusted resources and make sure that they're trusted through Panhandle Health, Department of Health and Welfare, and of course the CDC and the Kootenai County Sheriff's Office. So stay home and stay prepared. My name is Bob Norris, and I'm seeking and asking for your support to be your sheriff.